The Mental Health Parity and Addiction Equity Act requires that if you cover mental health benefits, the plan has to have the same copay or deductible or coinsurance as medical providers.
Welcome to Under the Coverage.
During each episode, we interview people, sometimes it's just each other,
Who spend their working days focused on health benefits and healthcare.
As consumers, we want the same thing you do.
We want the entire system to be less complicated.
Our guests share insights about how they navigate healthcare and the health benefits system.
I'm Jolene Myers.
And I'm Sarah Flusky, and we're ready to lament,
Complain,
empathize, and maybe help a few people. Today, we're going to talk about something that more and more people are using their benefits for, and that is mental health support. So from therapy visits to employee assistance programs, we're going to help our listeners today understand what's available to them and their plan dependents. First, I want to address coverage for mental health and substance use disorders. In the United States, large group health plans are not required to include mental health benefits for their plan.
So large group health plans, how many-ish?
Over 50.
Over 50.
Over
Okay.
50. So it is a requirement for smaller group health plans that it is included, but on the marketplace, it's a requirement for smaller group health plans, but for large group health plans, the Affordable Care Act does not require that plans include that as a part of essential covered benefits. Some employers might elect to offer it. They may also, or alternatively, offer a telehealth access to mental health providers, but you have to check your plan. So once they do decide to offer it, and it's a part of your benefits, the one requirement is that they must be equal to medical and surgical benefits. So it has to be covered at the same cost.
Why is that?
So the Mental Health Parity and Addiction Equity Act requires that if you cover mental health benefits, the plan has to have the same copay or deductible or coinsurance as medical providers. So your in-network, inpatient, and outpatient copayment and coinsurance must be the same. So you can't have a visit limitation or a higher copay due for a mental health provider than you would to go see any other type of provider in your benefit plan.
So there's another avenue for mental health benefits. It's called an Employee Assistant Program, or EAP. So it's a program that some employers offer as part of their comprehensive benefit program. Not every employer offers an EAP.
Mm-hmm.
They vary in what they offer, but some do include short-term counseling services or support for a variety of employee needs based on their plan populations.
Mm-hmm.
Um, if you aren't sure, it's worth asking because these are included at no extra cost. A lot of people that may have mental health issues or want to seek some kind of therapy, it's worth asking the question because I think a lot of people stay away from it because they don't think it's covered and they don't think they can afford it and therefore do not seek the help that they might need. So it's something to keep in mind.
Yep.
And it's easy to miss if you're enrolling in your benefit plan, right? You're not looking for that right off the bat. So it's something to keep in mind. And the services they offer can be of great value to you. And it's free.
Absolutely. And I think internally, that's one of the things that we look at promoting as it relates to our benefits, because providing access or including benefits around mental health and substance use disorders is optional on a large group plan, but your benefit plan might have an EAP. And I think those go so underutilized. But a lot of them are very rich with what they offer to people, from financial counseling to, access to discounts on things to limited amounts of mental health or substance use support or guidance. So I think it's like an under the radar benefit. So if a benefit plan doesn't include those, even if it does, I would argue you want to understand what's in your EAP because, like you said, that's a no cost addition to your benefits. So you might be able to have access to providers or counseling at a reduced rate than even your benefits might offer just to get you started.
Absolutely. So outside of your benefits, there are several options as well that we wanted to highlight today.
Absolutely.
So
get a pen and paper. Get a pen and
Yes.
paper. We're constantly saying that this season.
Yeah, but it's true. Yeah, so if you or a loved one are experiencing a mental health crisis, make sure you take some notes here. One option, you can visit 988lifeline.org or dial 988 or send a text to reach their Suicide and Crisis Lifeline. So it's right there. If you've got a phone, you can type it in and get the help you might need.
Yep, there's also samhsa.gov. There are a number of links there and tools to help find support, or you can call 1-800-622-HELP.
We have to talk about Mental Health America. Their website is phenomenal.
Right.
If you have a chance to pop on and check it out, it's mhanational.org. There's a lot of community resources listed there, a lot of staggering statistics too. So if you are feeling alone and you go on there and you see some of the stats, you might not feel so lonely.
It's a great resource. I like that it's a great organization. And not one I feel like you hear a whole lot about out kind of just living in the world. There's also the National Alliance on Mental Illness, and they can be reached at 1-800-950-NAMI, which if you're poking around on your phone is 6264. Or you can go to nami.org/help.
Also, if you know of any additional resources and you're listening to this episode, please do not hesitate to send us an email and let us know because, again, knowledge is power and we will certainly share that.
You can also add it in the comments so we can keep the list going if there are resources we have missed or even regional resources that, different parts of the country have access to, and we can point people to something locally if that's a really strong resource. We'd certainly want to promote that.
So that's a wrap on today's episode. If mental health support matters to you or somebody that you care about, we hope it gave you a clear picture of what to know, where to search for mental health benefits and resources. And next up, we're going to talk about how to handle coverage when both you and your spouse have insurance.
Yeah, we'll pick the right plan. That much we know.
Oh, yeah. All right. Talk to you then. This podcast is brought to you by Nova Healthcare Administrators.
Have a question or a situation you'd like advice about?
You can find us on X at UNDR The Coverage.
If you're into email, you can reach us at podcast@novahealthcare.com.
Don't forget to leave a review, give us a like or subscribe, but most importantly, share. We'll find the insiders.
You share it with the outsiders.